Well, the annual Walk to End Alzheimer's in Indy is just a few weeks away, and organizers say this year is perhaps more important than ever. A recent report shows a dramatic increase in deaths from Alzheimer's and dementia during the pandemic, both in Indiana and nationwide. Business of Health reporter Kylie Valletta has more. Kylie.
Thank you, Gary. In 2020, there were 870 more deaths from Alzheimer's and dementia compared to the previous 5 years. That's a 14% increase. More research is needed to uncover why the pandemic had such a devastating impact on people living with Alzheimer's. And that research is funded by events like the annual Walk to End Alzheimer's, which is taking place in person again this fall in Indianapolis after being only a virtual event last year. Natalie Sutton is the executive director of the Alzheimer's Association Greater Indiana chapter, and she joins me now to tell us more. Hi, Natalie. Thanks for being on the show today.
Hi, thanks for having me.
Well, we mentioned in the introduction a 14% increase during the pandemic in 2020 in Alzheimer's deaths and dementia deaths. That hasn't been fully fleshed out in research yet, but can you explain some of the factors of possibly what led to that increase?
Of course. Well, first, the population living with Alzheimer's and dementia were particularly vulnerable to COVID-19. This is an older population, sometimes living in communal settings, often also having other chronic health conditions. So some of these deaths that were attributed to dementia may actually be COVID-19 deaths, especially when we consider early on in the pandemic not having access to COVID-19 testing for those individuals. So that's one possible theory. I think the other thing is that there are pandemic-related changes in our lives that may have had a negative impact. First and foremost, social isolation for this population, but also maybe a more limited access to healthcare providers and healthcare services, and also changes to the routine and care that may have been provided by other family members or other kinds of caregivers that was unable to take place during the pandemic.
And most people with Alzheimer's rely on what's called an informal caregiver, typically a family member. The pandemic has been really challenging for them too. Can you explain some of the challenges that caregivers are faced during 2020 as well?
Absolutely. Well, caregiving is not easy in normal times, and certainly the pandemic has further complicated that. But caregivers may have dealt with changes in their ability to access respite care options, like adult day settings during the shutdown. Caregivers for those who have loved ones living in long-term care settings were unable to visit, sometimes unable to communicate with their loved one. And all of that has led to some really negative effects and some very emotional times for Alzheimer's and dementia caregivers.
Well, let's talk about the Walk to End Alzheimer's. You have an in-person option this year, only virtual last year. Obviously, it's one of your biggest fundraisers. Talk about the importance of that research, the importance of that funding, especially as it relates to research right here in Indiana.
Yes, well, the funds raised by the Walk to End Alzheimer's, which is our largest fundraiser, advance the association's mission. We're focused on using those funds to provide care and support in Indiana communities, but also to advance research, as you mentioned. We all know that our ultimate hope is to end Alzheimer's and other dementia, and that end will come through research. We're very fortunate also to be sitting here in Indiana, a leader in that research. We are actually at the Alzheimer's Association funding 11 active grants that total almost $3 million to Indiana researchers. So the Walk definitely supports our ability to make those kinds of grants to research important research projects.
And we talked off camera how the Walk took a financial hit last year, being that it was only virtual. This year, you still have a virtual option, but also, again, this in-person ability this year. Why is it so meaningful to have that in-person option to get back together again?
Yes, well, we just talked about the importance of caregivers in Alzheimer's and dementia, and having a loved one on this journey or being on this journey yourself can feel very lonely. And so for us, the Walk is always that one day a year when the community comes together. I think people feel hope They feel like they're part of a community, and we're so excited that we're able to get back to that, of course, with some safety protocols in place this year.
Right, only just a couple seconds left. Want to mention you had a special report focused on race and ethnicity, some non-white populations that experienced more barriers to dementia care. Just one big takeaway from that report.
You know, I think the biggest takeaway is just that discrimination in healthcare is having an impact on populations' access to Alzheimer's and dementia care and their outcomes. And so the report was really the first of its kind to assess and document that impact of discrimination. And I would encourage anyone who's interested to check out those findings.
Okay, Natalie, thank you very much for your time and good luck with the fundraising.
Thanks so much.